go to the chat, open the chat, and pick the second option of all panelists and attendees and say hi and where you're joining from. I can welcome you. I'd love to welcome you. Hi, Pamela from DC. You're already agreeing. Ahead of the game. Emily. Hi, Emily from Waynesburg, Pennsylvania. We got some East Coasters in the house. And hi, Danielle from Lynchburg, Virginia. Welcome, welcome. Barbara from Colorado and Heather from Abilene, Texas. And hi, Patrick from Chicago. It's wonderful to see you all here today. And everybody is, so far, everybody's done the all panelists and attendees thing, which is also great. Hi, Peter from Toms River, New Jersey, Ocean County Health Department. Do you know Peter, Ebony?
We may know each other. We may have crossed paths a few times.
And Andrew, who's in the background from Be Strong Families from Minnesota, originally from Wisconsin, currently in Minnesota. All right, well, it's 12 o'clock and we're going to get started. Hi, Lynette from Lynchburg. And today I'm here with Ebony Torres. She is our presenter on this important topic of managing your cancer or chronic disease diagnosis, resilience during challenging times. And we are launching a poll that asks you if you were here last week with Ebony, because she needs to just know how much she needs to go over, how much she needs to repeat. So if you could fill out that, we've got a few people in the house, 23 so far, 23 participants. Andrew, can you tell us how many were registered for today?
I believe we had 56 last time I checked.
Okay, so we're looking for about 35 or 40 people here today. So maybe we can wait to close the poll while I go over our ground rules. Ways to engage. The primary way you are already using, if you click all panelists and attendees to all panelists and attendees, not just all panelists, because if you do all panelists, then only Ebony and Andrew and I will be able to see what you write. But if you do all panelists and attendees, everybody will be able to see it. And since the chat is our primary way of interacting, it's the way that Ebony will get questions, or if she asks questions, it's the way that she'll be able to answer them. It's really important that everybody can see what you write. The second way is that you can raise your hand. And if you raise your hand, Andrew, who's in the background, will unmute you, and then you'll need to unmute yourself, and then you'll be able to talk. So without further ado, we're whenever Be Strong Families does anything, we have agreements. And these are in the service of co-creating a safe space for people to be able to learn, be vulnerable, expand and grow. So these are our agreements. We agree to speak from our own experience, to treat other people the way we want to be treated, and to be here now without multitasking. So if you agree to these agreements, if you can write "I agree" in the chat, that's great. Thank you, Anna. And a couple people already did. I saw that. I agree, I agree, I agree, I agree. Great. So I talked to Ebony a little bit before this. Do we have for the poll results, Andrew? 55% of the people were here, 45% not. So you have about almost half and half.
Oh, right.
And when I talked to Ebony, she's going to be presenting most. This is not one of our most interactive ones. I mean, you're free to ask a question. She's going to ask at the end of her presentation, she's going to ask if people have questions, and there'll be a Q&A session. But it's mostly going to be Ebony sharing information with you, and she's going to run her own PowerPoint. So I'm going to go into the background for this one, and I'll be back at the end. So take it away, Ebony.
Thank you very, very much, Kathy. Thank you, Andrew. I'm very happy to be here today. Let me just try and share my screen here. All right. There we go. All right, I'm gonna pull up the chat just so I can keep an eye on it. And Kathy, Or Andrew, if you'd like to keep an eye on the chat as well, of course, I welcome that. Alrighty. So thank you for those of you who joined me last time on part 1 of Ocean Monmouth Health Alliance's collaboration with Be Strong Families. And thank you so much again to Be Strong Families for letting us share this very important message about cancer and chronic disease prevention and as it relates to self-care in your webinar series. So we're going to be taking, as I mentioned in the first part, this new approach, this different approach from what you've been used to during this series in terms of self-care practices in the realm of managing a cancer or chronic disease diagnosis and really as a means of resilience. So this is me. My name is Ebony Torres. I am the bilingual community health worker with Ocean Monmouth Health Alliance. We are a cancer and chronic disease prevention coalition, and we oversee Monmouth and Ocean County, located in New Jersey. We belong to a very, very large institute full of a variety of prevention type programming, and this includes more counties than just Monmouth and Ocean. And we have a large New Jersey reach with our Children and Family Health Institute programs, including our cancer education and early detection programs, home visitation programs, all the works, and many more. And all of which provide free and low-cost services to underserved families. So really, our coalition is proud to unite all these various incredible community partners to implement prevention-focused education and awareness initiatives. And we're even more elated to begin this partnership with Be Strong Families. So just a little bit about what we talked about last week. Last week in our first webinar series, you understood how to measure your risk of cancer and chronic disease. We talked about the factors that raise your risks and the factors that lower your risks, and how we are still in control of those factors that we can, control in our life to lower our risk of being diagnosed with cancer or chronic disease. We also assessed any small steps we could take for and towards your healthiest life. And we talked about healthy lifestyle action plans. So in part 2, I really want to talk more about managing and understanding a diagnosis. We're going to discuss navigating life with chronic illnesses, and we're going to talk about ways that you can seek treatment. And really, I would like to make this as much of a interactive presentation as possible. I want you to feel comfortable and educated. So please feel free to put questions in the chat box at any time and share your experiences with me. I'd love to hear about why you're all here today and what brings you to this presentation. And so by the end of this presentation, I really hope to leave you with some manageable tools to make living with cancer or chronic disease or conditions less of a challenge and really help you develop the confidence to take control of your healthcare. So just some facts. As of 2021, the Center for Disease Control and Prevention states that 6 in 10 adults, 6 in 10 in the United States have been diagnosed with cancer or a chronic condition. So being able to cope with these unexpected life changes is challenging and in the best of situations. But during the coronavirus pandemic, of all things, going through a diagnosis on a regular day is challenging. But on top of that, having a coronavirus pandemic, we're just trying to get by each day. And really, those who have chronic or long-term conditions, health conditions like cancer or diabetes, or my father has lupus, as we talked about last time, those challenges become even greater. So what I want to share with you, though, it's not impossible to navigate life with a cancer or chronic disease. With strategic planning and preparation, you can try to have what you'll need to thrive throughout the pandemic and just really throughout your journey of your diagnosis. So, I want to also touch on the point of how chronic conditions, touch everyone in many different ways. Some of us may be caregivers, some of us may be survivors, others may know someone, just a friend. Uh, I would like to talk about my aunt. Her name is Marisol, and in 2009, she was diagnosed with lung cancer. She never smoked a day in her life, and in fact, she's one of the healthiest people I know. And so this was a situation that she believed that could never happen to her because she lived such a healthy lifestyle, she worked out every day. She just didn't understand why this was happening to her. And she honestly thought it could never happen to her because of the way she was living her life. But she did work with the cards she was dealt, and she immediately began to search for treatment options. So in situations like this, where someone is diagnosed with a condition, and in her case it was lung cancer, there's going to be a flood of emotions, a flood of everything coming in, and it can be overwhelming. It's important to remember that those feelings are valid, and are that you are in control. You have the control. My aunt realized, she's human. She had no control over how this was going to happen and never expected it. Of course, at first she was sad and really just ashamed to have been diagnosed, knowing that she had lived such a healthy lifestyle. And she did everything that she could, and she communicated with her husband, which is down on the lower left-hand corner, and he he evaluated his role, and he knew that he could support her as a caregiver. And she communicated that to him. She knew that some goals she wanted to set for herself, and now she's currently thriving. She has one lung. After the cancer, she had surgery, and it removed the 3 upper, middle, and top lobes of her right lung. So she just has one lung now, but you would never know. And so as when her husband evaluated his role and she communicated, he became more empathetic to her situation. He had never really understood you know, what how cancer and chronic diseases could impact his own life. And so when it finally came to it, he just came down to the same level as her and tried to help her in any way he could. So I share this story because it's really easy to believe that cancer and chronic conditions take away complete control of the rest of our lives. But like my aunt realized, there were still some ways that she could take control of the situation she was in. And keeping in mind, like I said, that she's only human, and asking her partner to evaluate his role in her recovery, he became her caregiver, and she was able to, and still is able to, live a very, very healthy life. Um, and it's very important to be empathetic, like I mentioned, when handling these concerns surrounding a diagnosis. It may come as a surprise to a lot of people, of course, but like I mentioned, it's their journey, and it's important to respect their decisions, support them how they're needed, and sometimes that may not align with how we think that person may need us. So communication is key. So this is one of my favorite expressions is the elephant in the room, right? In part 1 of this series, we talked about the coronavirus and comorbidities being the elephant in the room. And that elephant in a room is really just that obvious major problem or issue that people avoid discussing or acknowledging. You kind of just look away, and you don't talk about it ever. But really, instead of ignoring the elephant in the room, I think we should introduce it. We should really create conversations around these sometimes uncomfortable conversations. Because comorbidities can increase the risk of contracting other conditions and make us more vulnerable now, especially with the coronavirus, it's really important that we don't ostracize the elephant in the room. So how about maybe share some information, share in the chat box some of the ways that the pandemic has impacted you and your healthcare, and maybe some emotions you might be feeling or experiencing on top of your existing health struggles. And
I'm going to come back on and mind the chat for you, Ebony.
oh, thank you. I'm sorry. If for some reason the chat's not popping up on mine.
Yeah, it's okay. That's my job usually. I didn't realize that. So anyway, Julia says my aunt had a problem also. She used to burn a cobra in her room every night. Her lungs were black as someone that smoked, and she never smoked. So the question is, how has the pandemic impacted you and your loved ones? I think that for many of us, this might be a really challenging and triggering question and difficult to put in the chat, because I just know that in my life, my father died of COVID in November. So, it's like, I mean, that's it's not something that I would write in the chat, and I know that lots of people on my staff are also like, have had parents who have either died and other people in their network who have either died or been very sick with the virus, or who had other diagnoses that were delayed or not treated well because of the healthcare focus on the pandemic, so that just anything else kind of got put to the wayside. I also have a friend of a friend who went to the hospital in like April saying she had stomach issue, and they sent her home because she didn't have COVID, and she died because she did have something that needed medical attention. Peter says, I'm concerned that many people have a fear of following up with their physicians for their treatment, especially during this time of COVID. I think that's also very legitimate. I mean, I'm having some breathing problems, but I'm like, I'm not going. I have no desire. When I think about it, I'm like, okay, well, it'll either get worse or it'll get better, and I'm going to do what I can at home, because I don't want to go in. And Julie,
for the last,
what?
I was going to say, for the last year with this pandemic, has really seemed like everything has been on hold. Everyone's appointments have been delayed, and treatment options seem to vanish, right? You're wondering, you're left in this feeling of uncertainty.
Right.
So,
Julie says it keeps you away from those you love and care about due to an age barrier. You want to protect your loved ones, especially from those of us who have to be out there and meeting with all sorts of people. And people can't go to the hospital, as they could to watch and make sure their relative is getting good care, or to actually, be there as part of the healing process. It's much more difficult. Peter says telehealth has become an option for some. And that's also, telehealth is an option. I saw a dermatologist on telehealth, and thank goodness I, had an easy thing and I knew what I wanted. I can't see how you could really see my skin on telehealth. It's not really not the same. Lauren says she knows people who have given birth alone without their partner's physical support. So.
Right. And these are all very challenging, and it can cause a lot of emotions to flood in and make us feel fear, more anxiety, and a lot of other negative emotions about how we're going to move on from this situation.
Julia says we have to take care of ourselves by simply boiling some whole cloves strong with water. Bottle it and drink a shot of it daily. It helps cleanse your blood and keeps the virus from going further than your mouth. I take natural things to build my immune system. I know some other people were talking about other remedies that we do. Vitamin D is another one that I mean, they don't have like strong research on it, but they do have research that vitamin D deficiencies there's a correlation between vitamin D deficiency in people who get very, very sick with COVID. So it's an easy thing to do, is to take a supplement just in case. And Lauren says, I know a person who still has not had her postpartum physical appointment since her baby was born in October. So,
Right. And everything, so like I mentioned, everything is pushed off, and we're trying to grab at any resources that we have and that are available. So just like we're doing here, it's really important to create healthy conversations and find people who you're able to address these worries with and concerns, so that the elephant in the room doesn't take over.
I know also just in terms of what's happening right now, that the talk of the vaccine, and I know when I signed up, like it's so interesting that the comorbidities, like if you're suffering with a chronic condition, that means you're going to get the virus earlier, right? So I do know that a lot of people are, I mean, that's just a fact, that they're looking for people with the comorbidities to be able to offer the vaccine to after they get done with the essential workers and the aging population.
Thank you. Thank you for sharing that and sharing what everyone has mentioned in the chat box. I really appreciate everyone's input.
Sure.
So I'd like to go more into understanding a diagnosis. And according to the Living a Healthy Life with Chronic Conditions book, health problems can either be acute or chronic, right? But so an acute condition really is just basically it's sudden, and they have a single cause, and they're easily diagnosed. You can get better over time with rest, medication. But chronic illnesses, on the other hand, they usually begin slowly and continue to move slowly. And because of most of these chronic conditions start where you can really not really notice them, uh, they are they become worse uh, over time. And so we have, and when we talk about chronic diseases, I mean broadly conditions that last, a year or more and that require ongoing medical attention and really limit your activities of your daily living or both. So we, and so it's important to remember that the chronic diseases are unique to the individual. No one experiences the same experience. For example, with the coronavirus, like because people have different comorbidities, it may affect them in different ways. Yes, they may be preliminary symptoms, for example, but no one experiences the same way. So it's important to watch how the condition affects you and really just communicating with your healthcare provider where necessary. Peter mentioned the telehealth. That's a great way to stay connected with your healthcare team, especially during times like this. And so when you're diagnosed with a chronic illness, your world changes, right? I mean, my aunt, her world completely changed. She really became angry and she said, why is this happening to me? This isn't fair. She became afraid and she thought she would be a burden on her loved ones. She also became depressed. And, this all happened over a long period of time. Uh, Possibly she would think, this is something that I can't do. And I don't believe that no matter what I do, I can't make a difference, right? And she would isolate herself as well. So, and these feelings are valid. And in order for you to heal, you have to let yourself feel them and remember that you're not alone and that you have a very large community of supportive individuals who care about you and will support you how you need. This Be Strong family is literally a presentation and series is literally a family, a place where you can connect with people who are going through similar situations as you. Also, hospitals have support groups as well. There are Facebook groups that you may be a part of and other community organizations that you can be linked to. And so again,
from the chat, Julia says you need to also open up to people.
Mm-hmm.
I want to share an experience because I think when some of us, I know some of people on the call are probably thinking, I don't have a community of supportive individuals, who care about me. If I got really sick, I'm not sure I would have the kind of support that I would need. And I guess, this is just my own personal experience, but I'm one of those people who might have felt that way. And then when I got sick, I mean, and this is a while ago, but when I got sick, what I needed came. Do you know what I mean? So I think there's also just having a little bit of faith or a little bit of openness to the idea that if you did have a major health crisis, that there would be people who, and they weren't necessarily the people I would have thought of. Like for a reason, my mom was going to come to be with me, but then my dad had a health crisis, so she couldn't come. But the people that showed up were the people that I needed. Do you know what I'm saying? Like, it's like, so it's not always the likely suspects, but I think there's a certain amount of just having a little bit of faith and trust that 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 there will be what you need. And Julia says, if you feel you can't handle what's going on, don't go into a shell. Get someone that you can trust, or even if you don't have personal friends that you feel, keep your private information. A psychologist or friends that deals with peer counseling is great. Prayer is the best alternative. And Anna says, sometimes in the culture, your family says it's all in your head when you're having depression. And Anna says, but sometimes it happens that no one shows up.
Right. And I think that's interesting to say that fear is in your, like, depression is in your head, right? And it's fear, for example, it instills the fear. And not that the depression is not real and that it's not valid, but the fear itself, fear in general, is just like in our mind as well. So I think that's also really important. Thank you for saying that.
Well, and I think depression and fear are also in your body. I mean, I think that we have a false distinction between body and mind, and that there are things you can do from the body base to combat depression. There's a lot of research now on just your gut and your microbiome in your gut, and how that adds, how the neurons in your gut relate to the neurons in your head, you know, and that, so creating what you were saying earlier about managing a chronic condition with good food, you know, with proper nutrition and exercise, is if there are, you know, the thing we tend to think in this culture that if it's in your mind, you have to deal with it as a mental state and you're working with your mind, but sometimes you can mobilize your body to work with your mind.
Yes, exactly. And what Julia mentioned about, you know, going into a shell and, you know, instead of going into a shell, like be with people, let people know what's going on with you. And that is, I can tell Julia is a self-manager. She is able to use her skills and to regulate and deal with her emotions and be, you know, live her best life. If she is going through something challenging, she may reach out, and that is resilience.
So Julia, I just want to ask you, I just realized that you're directing your comments just to us. So other people, if they're trying to follow the conversation, they're not seeing what you're saying. So I just ask you next time, if you just do it to all panelists and attendees. Anna says, I had total knee replacement. The medication I was given put me into depression. I took myself off the meds because no one would work with me. So I tell people, listen to your family members. It's okay. It's all right. I was just reminding. No one would work with you? When you say no one would work with you and listen to your family members, and that no one shows up when you need them. I don't know. I'm just confused, Anna, about the story. So, but thank you for sharing your experience.
Yes, thank you, Anna, for sharing. Thank you, everyone, for sharing.
She'll speak. If we let her speak, she'll tell us. Anna, you got to raise your hand, and then Andrew will unmute you, and you'll be able to speak. And Julia says a lot of times when you go to the church, you could ask them for help. Are we seeing? Can we unmute Anna?
Yep, trying to find her in the participants.
Does she have her hand raised? She has her hand raised.
There we go. All right.
Okay, Anna, you have to unmute yourself, but then you can talk.
Can you guys hear me?
A little bit. You have to
hold on, let me get to my speaker.
That's good. That's better.
Hear me now?
Yep.
Okay. I've had in 1 year both total knee replacements. So it's something genetic that they told me we would have to always suffer because of my joints. The first time I kept telling them I was allergic to medication, but I had somebody with me. Okay. So that helped having a family member. But with COVID, I had my second knee replacement in November and nobody showed up. Everybody that said that would come started fearing because of COVID outbreak. Okay. So I kept telling the doctor, this medicine is giving me depression. They said, no, you have to take the medicine. And I'm telling them, I'm by myself. You don't understand. I'm suicidal. You guys need to take me off of it. And nobody would listen to me. So as working in the medical profession, I took it upon myself, but then I'm going to pay the consequences because then you don't heal properly because pain can tear up some of the stuff in your joints. So I tell people when I work with people and family members, please listen to somebody that's telling you what you're going through because in my culture, they're like, "Ay, Anna, you need to get out of bed." I'm Hispanic, so my family's like, "Oh, you're just being a big baby." And now going through what I went, and I just got done going with my son with another surgery. I come to find out my son is allergic to the same medicine. And now he goes, "Mom, I'm so sorry. I did not listen to you." So we go back to these things that doctors nowadays, because COVID, are so overworked that they're not taking the time to listen to all your concerns. That's what I'm sorry. I should have put that in all those notes, but it was too long for me to type.
No, I appreciate. Thank you so much for sharing your experience, Anna. And it's very real. And I'm sorry to hear that you went through the total knee replacement and you felt like nobody nobody showed up. At least virtually. I mean, I feel like the advocacy. I don't know. I just feel like if you would have emailed me, I would
Yeah.
have showed up. Do you know what I mean? Like, I think there are more people than you realize that care about you. Even just, I recognize your name and I know you're on here a lot, you know? and I really do resonate with people not listening when you tell them what you know about your body and what you know about your mind and what you know about your physical and mental state and not taking the time or to listen. And it can be lethal. So thank you so much for sharing.
Yeah,
Yes,
I feel like, not to interrupt, I feel like we have to share this because I know what kind of medical attention. I had total knee replacement. I was not supposed to be left alone for at least 6 weeks. I started driving 3 days after surgery because everybody that promised me they were going to take me, nobody did. And I didn't want to do Uber. So again, I told my doctor, honestly, I have nobody. I have to go to PT. I took it upon myself. Kids, they say, "Mom, you hurt yourself." And in some situations, knowing all what you were talking about, you do something that is sometimes not beneficial because I've had 2 knee replacements within 1 year, you know. But again, depression can settle in even if you're a normal, healthy mind, you know, because the medications that they're giving you nowadays, they don't know how to regulate what is good for you and what isn't. So, you know, I'm an advocate of basically people because I worked in the medical profession and my son just had surgery. I just got back from Dallas and I saw how they treated him in Dallas. And I was like, everybody's overworked. They do as little as possible and nobody's listening.
Yeah.
But COVID, you know.
Yeah. Well, thank you very much for sharing your experience. And I'm sorry that it happened that way.
It's okay. I'm alive, girls.
Yes, you are. You sound great. And we have total knee replacements. Almost everybody. I joke about it being a rite of passage for the women in my family. I haven't had them, but my mother, my grandmother, my aunts, my sister. So I have some idea of what you're going through, and it's not easy. So
don't put it off. I'm going to tell you one thing. I'm going to be
not in pain. So
and it gives you a better perspective on life.
thank you so much, Anna. Julia says, my husband had a major stroke in 2017. He went from bad to worse in character. And she's offering you turmeric and moringa will help you with the inflammation and pain. I think that's for you, Anna. And Julia is saying you can call her if you need to talk. So that's what Ebony was saying earlier, that Be Strong Families is a family. I mean, I think that there's just, you know, you don't even know how how willing people are to connect and where your support can come from. So Julia says depression is not easy to get over without having someone to speak to. Being suicidal is also bad. However, we have to have avenues to reach out. And she says she's been slated for a total knee since 1987. That's a long time, Julia. That's a long time. All right. And Anna says, I was put on turmeric and lost my hair. Thanks. And that's what we say. That's why we say in cafes, we're like, don't give advice. One of our agreements in cafes is don't give advice. You know, it's kind of because sometimes like when you give advice, people will say, oh yeah, I tried that, it didn't work. It's better to say this worked for me, you know. But that's so Ebony, I know you have a lot of slides and it's 12:34, so I'm going to go back to the being an active. Anna's got her hand raised again. Anna, do you want to say something? Julia says she's dealing with the pain. Oh, no, that was a mistake. Okay, good. So Ebony, back to you with the active health manager.
Yeah, so exactly what Anna was talking about is the perfect example of a self-manager, someone who is advocating for themselves and trying to live with a condition that they are trying to, you know, take care of. And she took charge of her own healthcare. You know, some people who've been diagnosed may manage by withdrawing and just forgetting about it all, socializing less, spending more time in bed, 24/7 even, and the condition becomes the center of their entire existence, right? While other people like Anna, she has the same condition and symptoms, let's say, and she somehow manages to push forward and really create her new normal and live as best as she can with the cards that with what she has been given. And so the difference between these two is that these two examples is that it's not the illness, but rather the person and how they are deciding to manage what is going on in their life health wise. And the note word is decide, right? And self-management and advocacy is always a decision. You can either decide to be active or decide to do nothing, right? Anna decided to be active, and she decided to seek help elsewhere and even take it into her own hands, so she wasn't suffering in silence, you know. So, and
Yeah,
she took this as an opportunity.
I think it's really true, Ebony. And I'm thinking about, but the previous slide that you had about all the emotions that can come up, not only with a chronic diagnosis, but I think, you know, one of the elephants in the room is pain, physical, emotional pain, because that can really cloud your ability to get to the self-management. I mean,
Right.
I get that Anna gave us a great example of feeling suicidal and taking action and deciding what she was going to do about it and it working. But I think that, you know, even those of us who are consider ourselves in normal circumstances and maybe at the beginning stages about active self-manager, that the pain can disrupt that.
Exactly.
Can you speak to that a little bit?
About pain?
Well, about like, even if, you know, like this becoming an active self-manager, you know, I love the empowerment message and the message of don't just do whatever the doctor says or don't, you know, but interact with it, understand that you're in charge of your life, take the advice, you know, figure out how it's going to work for you. Like that's all
Right.
about active self-management, you know, taking care of the condition, taking care of doing your normal activities.
Right. That's exactly what I have.
Of the illness. Like I get that. And I'm just saying, like, what takes people off of that sometimes is pain, right?
Yes, definitely.
Samantha's, oh, okay. Never mind. She's just telling us she has to switch over.
Yeah, so like Kathy mentioned, it's important that you're engaging in and advocating for yourself in your care and your health care. And that also includes setting a plan for yourself, whether that be handling yourself emotionally first then that takes priority as well. If you can decide what you want to accomplish for yourself, and then look for ways to accomplish your goal. So for example, let's say you are really depressed and you're just not sure which way to turn. You can talk to family and friends, and or even journal about it first, write it down and say, all right, I'm going to, in the next few days, and it's not going to happen overnight, I'm going to talk to a therapist and see if there are services that are free or low cost, and or even just talk to, for example, I talk to my sister a lot and bounce ideas off of her of how I can be healthy mentally, for example. And so we want to be sure that you're remembering, like we've been saying, that you have that network of people. You just have to be open to it and carry out your life as usual. You don't want everything to be, and it's very challenging. I'm not going to say it's easy, but you don't want everything to be about this chronic condition or illness or condition that you're in. You want to try and live as normally as possible and keep yourself up in spirits, knowing that it will turn out for the best. And you're more than your condition, like I mentioned. You manage your own life, and you, like managing a household, right? You say what happens, when it happens, how it happens, and the willingness to look and see with new eyes, and it really makes healing possible. And we begin by seeing and hearing the messages of these illnesses and symptoms from our body that our body is telling us, and we're able to understand these messages and remedy them, which can help us live a cancer and chronic disease free, hopefully, just alleviate little by little. So we talked a little bit about resilience in the beginning, and resilient people utilize their skills and strength to help recover with problems or challenges that they may face. And sometimes it may seem unimaginable, these events that happen like this past year. But resilience allows us to marshal the strength to not just survive, but to prosper. And some examples, including just small ways to build resilience, are holding positive views of yourself and your abilities, knowing that you can create a realistic plan and stick to it, and viewing yourself as a fighter rather than a victim. And just reframing your thoughts in these ways can help you to the next step of seeking support and focusing on what you can control rather than what is out of our control. And when it comes to seeking support, I think it's really important to note that, and someone in the chat mentioned it as well, that you want to have people that you trust and that you can confide in. That's really important when you're building resilience. Talk about your difficulties, talk about, different ways to cope, and sharing this can help you feel like you have someone in your corner. And when we are faced with these crises or problems, it's really easy to be overwhelmed by these things. And these things that feel like they're far beyond out of our control. And instead of wishing there was some way to go back in time and change things, because that's kind of just going to set you back, you just want to think about, again, what you can control. In Anna's case, she knew that she had the decision to either just stay there and just let the doctor tell her to keep taking the medication, or move forward and see what other ways she could remedy her own health care. So I came up with some few tips for setting goals for yourself when it comes to seeking treatment, right? You want to set a goal, perhaps maybe a short-term goal at first, and make sure it's specific, that it's measurable, that you're able to see where your progress. Make sure that it's not too I wouldn't say ambitious, but it's achievable for you, and that it's realistic, and it puts you, you want to keeping yourself in a timeline and know, okay, I've taken this step forward, I'm taking this step forward now. And these intentions can really help you plan for your future. you want to get connected with your medical home, create a medical family, and really assigning roles for your network of people to keep you on task and to share maybe adjustments to your goals and the SMART goals. And Ocean Monmouth Health Alliance, we help our patients and connect them with different medical homes and survivorship care plans. And we have a network of experienced individuals that we can help facilitate a care plan. And although our state reach is limiting, our state contacts can still help you find similar programming in your area. And so I always say that when you're trying to look for treatment, for the past 2 years, I needed shoulder surgery. And it took me 2 years to actually get the surgery. And I felt like it was a treasure hunt. And I made it playful and I said, this feels like a treasure hunt. I feel like I'm looking for clues as to the best way to get the help that I need. And so I don't get worse, right? And I had to really think creative, and thinking creatively really helped me win the game. When one doctor told me that they couldn't help me, it was just a strain. I kind of wanted to get a second opinion. So I got a second opinion. I got a third opinion. When I finally saw that third doctor, he said, you have a full tear of your rotator cuff and you should probably have already gotten surgery. And I'm like, well, you don't say. And so I did some detective work. I dug and I did research and I became my own advocate. So I evaluated my condition and I identified what I needed to do to improve my condition, whether it be just doing physical therapy for a little while. And even my mom and my sister, they helped me and they said, maybe you can do this exercise. They're like, I'm no doctor, but stretching in the morning can help. And so I'm more than happy to share. American Cancer Society, they have a survivorship care plan, almost like the tool that you can go into and input your condition and see how the best avenues for you. So, and life after a diagnosis, right? Like it's just feels like it's bewildering to think, again, how can I move forward? This is a serious illness and I'm scared, right? And you will have to make many, many, many decisions along your healthcare journey. And I came up with I didn't come up with it. I found this acronym. It's called GREAT. And I'm not sure if you've heard it before, but it is a great way to create decision-making steps. So you want to give thought to the situation. When facing a diagnosis, it's very easy to act on emotion or impulse, like Kathy was mentioning. And so we want to think about the ways that we can make decisions and where there may be areas for improvement. You want to review your options and take your time. When I was looking for resources for my shoulder surgery, I felt like I was just where my research was leading to a dead end, and I had to start over again. But I knew that this would take time, and with the proper patience and preparation, I would be able to find the resources I need eventually in the time that was necessary. And so again, when I saw each of those doctors, I evaluated, okay, I don't think this exercise is great. This exercise really hurts when I use my shoulder. I think I'm getting worse. Like Anna mentioned, she felt she was getting worse when given the medication. So she spoke up about it and thought, you're not giving me what I need. I'm going to go figure this out on my own. And there's nothing wrong with that. Being able to assess and decide what options are best for you, that is one of the best things we can do as humans. And remembering that the decisions that you make they don't have to be permanent. You can always change your mind if you feel like you want to take someone's advice, in like a family member's advice, like someone was mentioning in the chat, instead of a doctor, or vice versa. The options are limited, and remembering that life is like an ocean and you just keep swimming just like Finding Nemo says, Dory from Finding Nemo. I mean, we can move forward. And I really always emphasize this, and my aunt has always said this to me, to just create the balance of your life, and don't think about you as your illness. Um, you have the control, and yes, your illness may be at the center of your life, but it's not the only thing that's happening right now. Enjoy the little things and see opportunity in every corner. I'm going to talk a little bit about the beneficial services we offer in terms of navigating families to services, sharing community resources, referrals to programs, and just providing overall guidance for families and residents in need, whether you are experiencing barriers, a language barrier, or insurance, or any medical costs. Ocean Monmouth Health Alliance is here for you and definitely willing to refer you to the resources that you need. We also have access to major hospital systems and other self-care workshops as well. And we have a resource sharing guide that is live as well that can help you become your own advocate. And these are just some other tools that you can use to really find support. And if you are struggling with trying to, take those first steps in taking control of your healthcare, you can start here with this daily path to thriving. It is helpful to find support groups near you, whether it be seeking counsel from professionals in your area, and create meaningful practices to create a space that you can thrive and personally just grow and learn from your diagnosis. And it's really important. In New Jersey, we have these two really, really great resources called Mary Place by the Sea and Steffi's Place. So it's really a great way for those who are struggling again with either loss or a diagnosis. And these places offer groups of support to foster healing of the mind, body, and soul. And Mary's Place by the Sea specifically is a home for Respute home for women who are receiving treatment of cancer. And they provide all different types, medical treatment, Reiki, yoga, expressive writing. And these are all different, not homeopathic, remedies to rather than medicine, for example.
Are you talking about alternative or holistic?
Yes, holistic. Thank you. That's the word I was looking for. Thank you. Very holistic environments that provide these support groups. And Steffi's Place by the Sea is a new life support center. And they are able to help you feel like you're surrounded by those who have similar experiences to you and can speak the language of loss, for example. They're full of love, support, encouragement. And I'm sure you have resources in your local area. And I'm confident that I would be able to help and connect you to someone in your area to guide you to service similar to these. And I look forward to hearing possibly in the chat how people, any other resources they can share with each other, because I know this is a very interactive group.
I love the what you were just, that little wheel that, can you just return to the previous slide? This daily path through to thriving, I think is very, I like it. I like it a lot. And I like it a lot because I think that whether or not you have a chronic disease diagnosis or whether or not, life is kind of a chronic disease diagnosis. In a way, there's stress. And if we want to thrive through life, these are really important aspects that we do, as you're saying, Ebony, that we do have control over. So we do have control over, well, I feel like maybe like, and then I hear, because we've had some webinars related to self-care, and sleeping and eating, and there are barriers. But I also like your steps to great, which would help us overcome the barriers. So maybe your sleep is not healthy sleep practices, maybe your sleep is not so peaceful right now. but what can you do to be able to enhance the quality of your sleep? What are things that assist people with doing that, besides maybe medicine? You know.
Right.
So, thank you so much for offering this. I think it's
Thank you.
really good advice and guidance for life, whether with a chronic diagnosis or not.
Thank you. And this is near and dear to my heart. I really do hope if anyone has any questions that they ask them, or comments. Um,
Questions,
anything at all is
comments
fine.
for
And I
Ebony?
would like to invite all of you to follow us on Facebook, and you can receive the most recent information on health services in your area. And thank you for joining me. I did want to invite.
You want to invite what?
Oh, sorry, I was trying to control my screen. I did want to invite you to another event we're going to be having. It's a collaborative event with our many different partners in the area: Self-Management Resource Center, Shore Medical Center, Social Community Activities Network, Inspira Health, Virtua Health. And this is just a 6-week program designed to help participants manage the effects of cancer. If you are experiencing, or you know someone, you are a caregiver, a partner, it's really just helping participants create manageable action plans for existing conditions, and just really prepare them with an arsenal of tools for thriving. So I
So
can provide that link in the chat as well.
great. So is this open to people outside of New Jersey?
I'm going to say yes, it is open to everyone.
Does it cost anything?
No, it's free.
Okay.
Free virtual workshop.
Fabulous.
Yes. Oh, yes. Jenna Sistad, my partner here, she says yes to confirm.
Awesome. Well, that's a great resource. So if anybody has recently been diagnosed with cancer or is working, or is, as I said, it's open to people who are in active treatment. It's great.
And I included the link for registration in the chat box.
Thank you so much, Ebony. It's been wonderful. Thank you for I love your affect too. You've got a very sweet and calm and kind style.
Thank you. I appreciate it, Kathy.
Thank you very much. So everybody, thank you for being here today. Thank you for coming. And what's upcoming? We have tomorrow, the end of the week, Julie Fliss and Valerie Spiva-Collins are going to be here. And for all of those who are providing services to families virtually, there's a resource that the Child Welfare Information Gateway has put out to support child caregiver and family well-being in times of crisis, and kind of tips on effective virtual and phone engagement, best practices. So I know you'll be interested in that. Then Yoli will be here on Monday. This is the second in the workshop series on grief. And this is the anger of grief is the focus this time. On Tuesday, Lori Myron Manbeck is going to be here with the Sustainability Challenge. And sustainability is a really great concept for staying strong and positive. It's wide ranging and covers a lot of issues. So we encourage you to come there. Danielle Asher will be back. This time it's not an interview, it's a workshop on family engagement, the missing link to school reform. And then Robin and I will be holding space for conversation on navigating challenging conversations at work and at home. And that will be, of course, interactive. It'll also tease some of our trainings because Robin is our National Director of Training and Technical Assistance. So as you're leaving, what would you like to amplify? What about what Ebony presented today do you think needs to be amplified to create a more perfect union? I think what I would put out there, so Andrew, if you could write it for me, would hashtag amplify listen. And I think that for the healthcare professionals and for all of us as we listen to people, and hashtag amplify what? Support? I mean, I feel like there's something, it makes me sad to think that people would be alone and not supported when they're going through something very difficult. So I mean, I think that the one side is listening, but the other side is hashtag amplify, reach out. Let people know what's going on with you is one of the takeaways I have from this. from this presentation, we've got to let people know and give them the opportunity. And even if some people disappoint us, we just to keep having faith. So I think that keep having faith, keep the faith. Andrew, who's in the background, this is Andrew and his wife Michelle wearing our Be Strong Families masks, reminding everybody to wear their mask. And if you want a mask that expresses your values, these are available on the Be Strong Families website. Finally, Ebony volunteered. Ebony came to us and said, I'd like to offer this. So these webinars are by the community for the community. So I'm looking for volunteers who would like to host a webinar or like to do a presentation. Can be something you're workshopping, can be something that you have never done before. That's okay. And if it's also could be something that you just feel like it's a topic of conversation that you feel like should be covered and hasn't been covered yet, or you would like to be part of a conversation. So please hit me up, email me. And thank you everybody for being here, and have a wonderful rest of your day. See you tomorrow or whenever you can join.
Thank you.
Take care.